Doctors of Reddit, what's your thank god they came in for a second opinion moment? Hi doctor here. I had a patient I saw several months before they came in for their visit, but well less than a year. Which often means something could be wrong. In this case, as it turns out, nothing was wrong with her by way of complaints. She just wanted to get updated before getting some new glasses. We decided to just run the regular gamut of tests anyway, just because we might as well while she was there. She was a 50-year woman. Fairly normal exam. Perfect vision. Retinas showed healthy. But something about her pupils really bothered me before I dilated. We chatted about it and I asked her if she banged her head or anything weird and she said no. But suddenly reveals this crazy history of an old meningioma, a type of tumorous brain growth she had removed a few years ago. She had decided to omit this from her history with us as she didn't feel it was important. But we went and put it into the charts anyway. Turns out she got a CT done 2 weeks prior to her exam with me, which she says turns up completely normal. I tell her she should tell her doctor about this anyway just to cover our bases. Fast forward. Patient shows up in my office ecstatic to tell me that my examination revealed that her tumor had returned with an incredible vengeance. She had no idea. Was totally asymptomatic, and the CT she had prior to me showed what was very literally the size of a speck of dust, which the radiologist dismissed as artifact. On her return to her doctor, they decided to rerun the CT to cover their bases. And they found a quarter-sized tumor. Within 2 weeks the tumor went from the size of a dust particle to a quarter. She was rushed into emergency surgery as the tumor was growing super fast and was close to a blood vessel, which could cause a massive stroke. She had it removed that day and returned to me after recovery to tell me of what got discovered as a result of my testing. She is now a long-time regular patient I have been seeing for about 10 years. Edit. Thank you, kind giver of gold and silver. It's good to be gilded. Edit. For those asking about the pupils, they were asymmetric, and the larger one reacted less robustly compared to the fellow eye. This was a marked change from her previous examinations where no pupillary defects were noted. I'm a semi-retired physician and I don't believe in second opinions. I much prefer 2 first opinions. Edit. Thank you, readers. Never thought these 2 sentences would explode like this. Thank you very much for the silver and gold. Thanks to all who follow. I'm not a doctor, but I'm glad my parents took me in for a second opinion when I was complaining about a bad headache when I was 15 years old. I left school one day and went to the hospital for a bad headache. The doctor said it's just a virus and that I should just rest and take meds. I went home, lay down and took some Advil and carried on with my night. Around 1 AM, I was screaming on the floor. My parents took me to a different hospital and they ran tests and eventually did a spinal tap and discovered a ton of white blood cells. Turns out I had bacterial meningitis. Oh god, where to start? I literally just admitted this lady to IQ, had been coughing for ages. 60 pounds weight loss. Smoker for 50 years. Now she can't breathe and I got a CT 6 centimeters mass, looks very suspicious for lung cancer. And the doctors for 4 years throughout this just gave her vitamin D even though she was losing massive weight and coughing up blood. Another guy who came in looked pale as a ghost. Chief complaint was fatigue. One lab test later found out his hemoglobin was 4. Barely on the cusp of survival. Seems like he had iron deficiency anemia for years. Doctor gave him some iron. He got better but no one looked into why he got it. Number 1, 2, 3 reason in an older guy is colon cancer. He died 4 months later from metastatic colon cancer. Another story last month was about to take a long trip across the Pacific. 1 hour in on the flight they ask for a doctor. I volunteer myself. I see this lady literally gasping for air, like waving her hands in the air cause she can't breathe. Look through the meds, she's obviously an asthmatic. Listen to her lungs and faint wheezing, no air movement at all. I later grounded that plane because there was another 16 HRS to go and she was on verge of being intubated. Later I get more story from family member. Apparently she wasn't been able to sleep well for past 2 weeks. Doctor just gave her sleeping meds, more and more of it. Told her flying no problem. I asked the family why can't she sleep? Is it because she wakes up in the middle of the night gasping for air? Classic sign of uncontrolled asthma. They're like, yes. How did you know? Sleeping meds prob among worst things she could have gotten and almost killed the patient by saying she could fly. People who get diagnosed with bronchitis when they have heart failure and literally drowning in fluid. There are doctors who give antibiotics and steroids for everything esp when they have no idea what's going on. Maybe I'm biased because I work at an academic center, so I see all the cases who get referred in because they're too sick or no one can figure out, but at least a few times a week I'm like, wow, this person could have been saved or not end up this way if someone cared enough earlier on. I'm going to say this as a doctor. It's honestly scary every day how many patients I see are completely mismanaged. Some doctors in urgent care see like 45 patients in a day. How is that possible to be thorough? Like if only patients knew what the doctors missed or what not done half the time. I really think it's like going to a bad auto shop and not realizing they're just making half the it up. Same thing happens in medicine, and except people's lives suffer because of it. It added a story. Thank you to whoever gave me silver gold. Let me say something. People are saying I'm Gregory House or something. I'm not. I purposely didn't choose stories that were some esoteric diagnosis. Everything I picked is like bread and butter medical student level. Half of being a good doctor is knowing what questions to ask. Sometimes you don't even know what's important or not. The other half is caring. Too many just put a band-aid on the problem and punt the patient to someone else. Is it the doctor's fault? I don't know, but I do know the medical system in the US provides no incentives for doctors to actually practice good medicine. In fact, I bring in less money if I'm thorough versus I do the same thing every patient and see 100 patients a day, which is what some do unfortunately. I have tons more stories. Hopefully I'll get to share some more, but for now have to sleep. Was on call overnight. Edit X2. Thank you again for all the guilds. I don't even know what they all do or mean, but I'm very grateful nonetheless. Few more things I wanted to say. There are plenty of amazing doctors out there. Not all are bad. We all put our lives on hold for 10 years for altruistic purposes. Not everyone just wants to make a quick buck, so I hope I didn't characterize it as such. I tried to respond to some comments, but I don't have time to respond to all. A lot asked, so how do I find a good doctor? The answer is, I don't know. I've tried looking for good ones myself and it's hard. I joke you should find the doctors all the other doctors go to because I have a higher BS meter when I meet a bad one. Doctor rating websites are garbage. I've seen doctors get great ratings because they just hand out opioids, benzodiazepines to everyone, even if all his or her patients become addicted later. A lot of it is really your gut feeling. A good one should listen to you and, most importantly, sometimes be confident enough to say I don't know but I'll look it up or send you to someone who does know. The scariest ones are those who don't even realize what they don't know. And the most perplexing thing to me, if you don't like an auto mechanic or realtor, you would find another, right? Do the same for doctors. It's your life. Can be a difference between living or dying one day. Go find someone who will advocate for you. It's the least you can do for yourself. I can't count how many I was told it was a headache, but I just wanted to come in and have it looked at in case it was something else I've seen. Of course, those are the patients that are the nicest and are profusely apologizing for wasting our time. And of course, those are the patients that have a brain tumor show up on their CT scans. Edit. Well, this blew up. Big apologies to everyone, but I'm not a doctor. I work in the hospital alongside other doctors and I get the chance to see everyone they see. Apologies if I misled. That was not my intention, and I will make sure to be clearer next time. I'm an emergency medicine doc in the Midwest USA. The patient was transferred from rural nowhere to our tertiary care facility. Big hospital with every specialist. Call was of really bad quality, but the transferring physician described a 21-year-old male that had rapid heart rate and breathing rate, low blood pressure, low oxygen, confusion, and a severe opacification on his chest X-ray on the right side. Diagnosed pneumonia. He gave him a ton of fluids, started antibiotics, put him on a ventilator, but he wasn't getting better, and wanted to send him to us. Sure, send away. An hour later the gentleman arrives, and looks young, fit, and not the type to just drop dead from pneumonia. We roll him onto our stretcher and find a huge stab wound in his back. The X-ray finding was his entire right chest full of blood. We put a tube in it, gave him back some blood, and he had to go for surgery to fix the bleeding. Lesson: look at your patient. Dermatologist here. I have seen probably 5 instances of my other doctor told me it was fine. That were melanimous. A lot of times people don't want a full skin exams. There are lots of perfectly sane reasons for this. Time. Perceived cost. History of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind if you see a dermatologist for acne and they recommend you get in a gown. Had a patient come in for therapy after his PCM yelled at him for being a hypochondriac and saying his symptoms were all in his head and that he was just trying to fish for disability. His symptoms were pretty obviously neurological, so I referred him for an MRI. To my shock, he had only ever had x-rays. Sadly, I had to tell the 19-year-old man that he had multiple sclerosis. With great satisfaction I got to tell that PCM he done goofed and that I would be talking to our mutual chief of clinical services about the incident. Edit. 1. Thanks for the silver. You all rock. Not a doctor, but I heard my son's doctor say this. I took him to the ER late one night because of coughing and a high fever. They took an x-ray, gave him ibuprofen, and told us he was fine. Doctor showed me the x-rays to prove it and gave me a dirty look when I asked what the dark spots were. I told her she was an idiot and took him to urgent care 4 hours later. The doctor that saw him immediately diagnosed him with pneumonia and confirmed with x-rays. I flat out refused to pay for the ER visit and told them that if they persisted with collections I would push their incompetence. They never called me again. Edit. This really blew up. I would like to thank all the fine medical professionals out there for explaining dark spots on x-rays. These are the exact answers that I was expecting for my question to that doctor. The fact that I did not receive any explanation of any type and receive backlash at the mere questioning of a diagnosis would indicate some type of insecurity or complex that makes that doctor put their time and feelings ahead of my child's health. The fact that all of you spent a few minutes explaining and typing this on Reddit really makes that doctor look really bad considering she couldn't spend 30 seconds giving an explanation. 22-year-old guy came in after seeing his primary at another hospital. His mom was my patient and asked if I would see him. I am an internal med doc. He had told his doctor he had a headache. I did the usual full review of symptoms since he was new, and he also marked his left testicle had a lump. Did exam and he had hard small lump on testicle. Knew right away likely had metastatic testicular cancer. One stat brain scan and testicular ultrasound later confirmed it. Asked him if told other doctor about the lump and he said yes, but the other doctor told him it was normal. Edit. He lived by the way but it was close a few times. So fellows, if you note a lump on your testicle, ask for an ultrasound and don't be embarrassed to bring it up. Edit 2. For those of you who are concerned after examining yourself, there is a small soft area posteriorly that should be similar on both your testicles known as the epididymis. That is normal. A hard lump on only one side only is not. Monthly self-checks between ages 15-34 can be done, but since rare, 5/100,000, not a general recommendation. ER nurse here. Had a lady in for simple pneumonia. Her 13-year-old son was getting bored, so I showed him some equipment. I connected a simple heart monitor to him and discovered he was in a complete heart block. I printed a strip and showed it to the doc. We suddenly and unexpectedly got a cardiac patient. Can I go ahead and speak on behalf of my doctor? 19 meters at the time, 33 now. I felt sick for about a week. Flu-like symptoms. Didn't want to eat. Just felt bad all over. One day at work I feel a very uncomfortable cramp tear in my abdomen. So I go to one of those 24 hours clinics. At this point I'm slumped over. Can't stand up straight without insane amount of pain. Just generally uncomfortable and hating life. After a few hours at this clinic, they say you probably have kidney stones. Go home. Drink fluids. Sleep it off. This seemed fine to me. I was ready to go home and listen to the doc. All was good. But my girlfriend at the time didn't last much longer than that, wasn't a fan of this diagnosis and drove me to the ER. Against my wishes, of course. After a few minutes at the ER, they determine my appendix has ruptured and I'm going septic. Apparently I was pretty lucky to not have died, though I did pick up bacterial pneumonia while in the hospital, so the recovery kinda sucked. Now I just have a crazy 6-7 inch scar on my belly to remind me to not avoid hospitals when I'm sick. Edits. More info. Medical terms. etc etc. I had a guy come in for a second opinion after the first place didn't bother asking any medical history. Of course I took his history and asked more questions as we went. I remember telling him something felt off and we needed to run a test. So I ordered a peripheral vision test. When I got the test back I was shocked by the most classic tumor pattern I'd ever seen. 2 weeks later he was in surgery to get it removed. A month after this guy was back in my clinic thanking me. Totally different guy. Personality was a complete 180. Energetic and happy. Edit. Here's another one I thought of though a bit more sad, but also good at the same time. Here's a cautionary tale why urgent cares should never treat eye issues. Lady was referred to me after 2 weeks of treated for a red painful eye. The PA and MDs that saw her tried allergy meds and antibiotic is thinking it was allergic or bacterial conjunctivitis, or hoping it was mild viral that would resolve on its own. So I took one look at her and knew it was a herpes simplex infection in her cornea. She was in pain and had been mistreated for 2 weeks. Got her on antivirals, but after discussing how it was odd she didn't have any active herpetic sores, but had a really bad cough that the ER said was just pneumonia and would go away with antibiotics. I told her to get it checked with a pulmonologist because it didn't sound like pneumonia and it wasn't getting better. I saw her 3 months later to monitor her corneal appearance and she came in using a wheelchair. Turns out the pulmonologist was blown away that the ER had dismissed her. She had a really rare small cell lung cancer. The reason the herpes infection manifested in the first place was her immune system was compromised. She told me the pulmonologist said I'd saved her life because they caught it early. It's been a bit over a year. She's still undergoing treatment but her spirits are strong and she's optimistic as is the pulmonologist. Not a doctor, but remember reading something related in another thread. UP 1729 said, "Here, more than my girlfriend is an ER doc. A hippie type guy came in a week after a bike accident. He'd been treated and released by another hospital. He was complaining of some neck pain. She immediately had him backboarded and ordered X-rays. More than the X-ray tech called her and asked why, when he had been treated across town. Were they X-raying a guy who was obviously indigent? More than because his neck is broken. Okay, more than she was right. If he had tripped on a doormat and fallen, he would have likely been paralyzed. More than I like to remind her of this one when she's had a hard night of fighting off drug seekers and attention W. My grandmother had her hip replaced, but the hip always hurt to her. She waited a year, hoping it would go away but it never did. She asked multiple doctors and did multiple x-rays but doctors said the replaced hip was fine. We finally made her go to a private clinic in my hometown. The doctor saw that the replaced hip was fine and dandy, but the bone around it looked like it was a tad bit eaten by bacteria. So the new doc did an operation, and there was so much pus in the leg it was insane. If my grandmother waited any longer, her blood would become infected and she would have died. Thank goodness she went to the clinic. Not a doc, but happened to my wife and I. She was 3 months pregnant and did ultrasound. All normal. Baby heart rate was 99 and healthy. However, for some reason, the ultrasound tech forgot to measure something and doc ordered a second ultrasound. Second upped in about a month. As my wife wanted to delay as she hated having to drink so much and not pee so the ultrasound comes out clearer. I couldn't be with her for second ultrasound as work got in the way. However, she calls me tearfully saying that the doctor ordered she abort the fetus for her safety and her health and she insisted on calling me to let me know before she did the procedure. Apparently the baby heart rate hadn't changed since first ultrasound a month ago, and this was bad enough to put mom at risk in pregnancy. I ducking flew to the hospital. I can't remember how I got there but I crossed heavy traffic to the hospital in about 10 minutes of what is normally a 20-minute trip. Parked on curb, jumped out and rushed to her room. Thankfully nothing happened to her yet, and I just camped there insisting on another ultrasound. I kept telling the doctor it was a copy-paste error. You see, the heart rate from first ultrasound to second was exactly the same. I knew, just knew, that the tech copy-pasted the first report and forgot to update that rate. I screamed bloody murder if anyone would touch my wife. Security was almost called until another doc came in and said just do another ultrasound to decide the issue. They ordered a second ultrasound and heart rate was normal. My son is now 10 and I remember that fear and rage every day I look at him. I was like 10 and my parents took me to the doctor cause I thought I broke my leg skateboarding. He said it was a 3rd degree sprain, told me it'd be fine. I pointed out lines in the x-ray and he said they were nothing. I somehow convinced my mom to take me somewhere else and they confirmed I had multiple hairline fractures in my growth plate. Wife went to ER for pain in her pelvic region. Ultrasound showed a mass. Probably an ovarian cyst, they said. It will pop in time. Leave it alone. Went to THDR about a week later. Had a surgery to pull it out maybe a month later. Did a biopsy on the mass. It was ovarian cancer. She is now cancer free, but WTF. Bit of a weird one. Because the request for a second opinion came from an intensivist and I was a contributor to their treatment plan. I work in poisons control. Had a call from a green but very astute young doctor with a middle-aged female patient presenting with a vague 36-48 hours history of malaise, confusion, hypoxia from hyperventilation, and hallucinations. On workup was noted to have pulmonary edema, lung fluid buildup, metabolic acidosis, acute kidney injury, sinus tachyon, raised CRP and WCC, suggestive of infection but no temperature. The initial diagnosis was sepsis. This keen-eyed doctor, pretty fresh out of med school, decided to do a salicylate level on this lady because the hyperventilation paired with metabolic acidosis and RQ was enough to prompt her suspicions of aspirin poisoning, even though they could just as easily be explained by sepsis as well. The level came back high, not huge, but high, which prompted her to phone me for a second opinion on how relevant the finding was in terms of the patient's clinical picture. Simultaneously, the patient's family investigated the property and located numerous aspirin blister packs suggesting she had been dosing herself for chronic pain, which was present in the medical history. Chronic salicylate poisoning is insidious and has been referred to as a pseudosepsis in the medical literature as it often causes similar features, comparing a higher level in chronic poisoning to the same level in acute poisoning. Features are much more severe in chronic poisoning, that is, pulmonary edema, hypoxia, RQ etc. There is a disparity. We recommended certain treatments, all hail sodium bicarbonate, and the patient made a full recovery after a 2-week hospital stay. Whilst there was no question an infective cause was present and contributory, I was impressed with the green doctor's intuition and willingness to consider other causes. I feel like it greatly improved the patient's treatment. Edit. Some words. I'm not a doctor, but I originally went into the doctors because I was really tired. The doctor waved it off, but my mom insisted I should get a CBC, complete blood count. They found that my platelets were extremely low, which resulted in them running additional tests to find that I actually had acute lymphoblastic leukemia. No idea to this day why my mom made me go back to get a CBC, but I'm grateful. Edit. I get it, it's grateful. Edit number 2. A lot of people are saying that the doctor should have run a CBC to start with, but in her defense I am a minor and it was a school day, so I think that the doc thought that I was tired from sports or something normal and was trying to skip school. Psychiatrist here. A 30-year-old man with mild depressive symptoms was in and out of the hospital fairly quickly. He was under pressure from his home life, living with 4 roommates who were making life a bit difficult for him. No suicidal thoughts. He was cleared of all psychopathologies by me and 2 other doctors. A few months later he came back. Same symptoms. However, this time he talked about 5 roommates. It felt wrong, and I digged in his story. Tried to contact his roommates. He lived alone and was severely psychotic. I have no idea to this day how he hid it so well from everyone. Edit. A few more details. The patient talked, dressed and acted normally, however after admitting him for a longer period we noticed he talked with his roommates often. He was single, no contact with his family and somehow working, however in a routine job with little to no personal contact. After a few talks he also claimed other people's thoughts were sometimes thrown at him and sitting on his head, and he could thus read people's minds against his will. The interesting thing about this patient was that his internal world somehow fitted the external world when asked. His roommates sounded perfectly plausible. They were not, for example, shadow people, Vikings, 12 meters tall, and they teased him by hiding his stuff. But he ate with them, watched TV with them, so on. Normally a person with paranoid schizophrenia, paranoid meaning all types of delusions, will have multiple symptoms sometimes easy to see for the untrained eye. The patients can dress, talk and present themselves in odd ways, usually different from cultural norms. They can have incoherent speech, make up words and phrases or are clearly separated from reality. Another patient of mine insisted that I was in jail for medicating him, even when we talked. When we quickly scan a patient for psychotic symptoms, we basically look for inconsistencies in the patient's experience of the world. The patients normally know something is wrong or weird or different, but often believe it is the world around them that have changed. This is due to discrepancy between what they experience, input, failed assessment of the inputs, due to the thinking disorder, and testing hypothesis based on failed assessments which collide with the real world. This will activate defense mechanisms, FX denial, wild explanations, accepting both realities at the same time, and so on. For example, I am not sick. My doctor must be a bad guy. Bad guys are in jail. My doctor are in jail, but my doctor is sitting right in front of me at the same time. He must have an identical twin, or this is an alternate reality. This is usually the way delusions are made. To summarize, when we scan for psychosis, we look for inconsistencies between the patient's subjective experience of thinking, being and acting and the objective reality accepted by the general cultural norm. This patient managed to live in a subjective psychotic world that just fitted so well with the objective reality that he tricked several psychiatrists, including myself. This is a I wish I had gotten a second opinion story. I had a doctor in high school who was unconcerned when I suddenly developed vertical double vision, which was freaking out everyone in emergency, where I had gone initially, and lost 60 pounds for no reason. It was only a year or two later when I told him that my arm would fall asleep much faster than normal when I raised it to ask a question in class that he thought there might be something wrong with me. MRI ordered. Brain tumor found. Not a doctor, but the patient. Went to my family doctor with the worst headache of my entire life. She dismissed it, telling me it was a tension headache and that I should take a Tylenol and lay down in a dark room. Over the course of the next month, I saw her a total of 13 times, each time with worsening symptoms. First it was dizziness, then vomiting, then eventually I could no longer see out of my right eye. Every time she told me it was just a tension headache or a weird migraine, gave me a prescription for painkillers and sent me on my way. The final straw was when I was no longer able to walk properly. I would try to take a step, but all I could manage was this weird shuffle. She reluctantly agreed to send me to a neurologist. The next day I showed up at his office and was in there for less than a minute. He took one look in my eyes and immediately called an ambulance. Turns out I had hydrocephalus. My ventricles were 5x the size they were supposed to be, and my brain was literally being squeezed out of my head. Go figure. Till doctors don't spend a lot of time ducking off on Reddit. I got a moderate traumatic brain injury in October, and the week after I got home from the hospital I wasn't acting like myself, was refusing to eat and just didn't make much sense. My mom called the doctor a few times. They said it was normal but to take me in if anything changed. She took me in on the Saturday a week later because I started slurring my speech and was unsteady on my feet. The injury caused my sodium levels to drop from 140, normal, to 119. This in turn caused stroke-like symptoms which were in reality a series of small seizures. Not a doc, but a nurse. At a clinic a lady came in for breast pain with a lump. I was in the room for the exam for safety of everyone. The doctor told her it was a sprained muscle and to go away. When he left the room I told her the name of one of our other doctors that specializes in women's health. Told her she could not let this go. She saw him and he referred her for some radiology, and that's how they found her breast cancer. She later told us all this in a sweet card she sent telling us if I hadn't told her to advocate for herself she may not have followed up. Edit. My first gold ever. Thanks so much friend. Edit. OMG 2 golds. Wow, thanks again. If anyone can take something from this, just advocate for yourself and your families in healthcare matters. Sometimes you have to make them see it. This guy was told he had pink eye. He had metal shards in his eye from welding. One of my sister's friends was diagnosed with cancer at age 10. They were advised to pack up their stuff and move across the country to go to a specialist because they would have to stay there for at least a year. They even had to hire a private plane so she wouldn't get sick on the plane from any passengers. Well, before they left they got a second opinion saying it was pneumonia. Then they got a third that again said it was pneumonia. Now several years later she is healthy and never got cancer treatment and has been tested for cancer regularly. Not a doctor but have had a second opinion. Save my PP. Noticed blood in my urine and went to family doctor. Family doctor said it was a normal injury and would go away. Went for a second opinion with a urologist and after a bunch of tests they found scar tissue built up in my urethra that was causing inflammation and if left untreated would cause the urinary tract to close. So they removed the scar tissue and I about cried while peeing for weeks after, even while on pain medication, until it healed. But at least I could still pee and that was thanks to the second opinion.